couple of minutes. These are nurses and other staff at hospitals. We've masked their identity because we don't want any repercussions for them.
It's almost normal now to be short-staffed every day. It wasn't like this when I first started nursing.
You think it can't get any worse, and it just got worse. I was going through increasing panic attacks before work, crying before I got out of the car. I loved going to work when I first started. Now, I dread it. We're always working short-staffed. We have a backlog of over 2 years. We hardly have time to take breaks or go to the washroom. I don't think that patients are getting the care they need.
Seeing the system, the way it is, I'm getting scared to get sick myself. Do I really want to come to my own facility? The exterior looks fine, but on the inside, everything's falling apart.
They've cut me up into pieces. They spread me so thin that I don't have the time to provide the level of care that I would love to provide. So, I just do what I can. That's where the pressure comes in. And the anxiety and the guilt and the feelings that I should have done more, but I can't. I can only do so much. And then with the issues that we have at work and the concern about patient neglect and the physical part of the job is so draining. My job is killing me.
It's embarrassing to say I don't have the compassion that I used to have. I'm not at all the nurse I wanted to be. We all recognize that it's hard for patients too. This is not the kind of healthcare they deserve.
This is what the government is doing to our healthcare system.
Thank you, Michael. And as Michael said, thank you to everyone who's come. I'm going to be reading just a quick opening statement. I have macular degeneration, and so I'll have to be looking down and so on and so forth. So I apologize for my delivery here. Today we are releasing our fourth study exploring the condition of Ontario staff and their well-being, hospital staff. It's titled Running on Empty, Ontario's hospital workers' mental health and well-being deteriorating under austerity-driven system. Over the last 7 years, we have talked to hundreds of healthcare workers from across the province about their working conditions and their resulting concerns. We started by exploring the issue of violence, both in hospitals and long-term care. We learned that violence has been allowed to reach such a level that it is now considered simply as part of the job. We heard about daily incidents of physical assault, including life-altering injuries. We heard about verbal assault, including sexist and racist abuse. We went on to explore how the stresses of the pandemic affected healthcare workers. We heard about the frustration and fear that they experienced when the government failed to provide the support and protection they needed. And now, with this most recent study, we examine the impacts of underfunding, understaffing, deregulation, and privatization on the mental health and well-being of Ontario hospital workers. Our interviews with hospital staff from across Ontario revealed a disturbing picture of their working conditions, their level of distress, and their frustrations over the care that they are trying to deliver. We found a workforce facing increasing anxiety and frustration. We learned from those we interviewed that many are suffering from depression. Several said that they now cry before beginning a shift or on their way home. Physical and mental exhaustion, which extends into their home life. Burnout and even hopelessness. Mental distress because they are unable to provide the care that they know is required.
People need to vote.
We heard about the daily fear hospital workers felt going to work and being unable to perform the duties of caring for their patients because of understaffing. And several said they just wanted to quit. In other words, this study found that our cherished public health care system is in serious trouble.
Because it's goddamn government.
When we sought to understand what was behind the problems healthcare workers were facing, we learned that 20 years ago, Canada had held fourth place out of 11 high-income countries in terms of healthcare performance, but fell to 10th place in 2021.
Thank you, Dr. Wood. And
Canada ranked
conservatives
only slightly
across
above
the
the
country.
United States, but both were at the bottom of that list. Unsurprisingly, nurses' vacancy rates have nearly doubled under such conditions since 2019.